Hello, my name is Debbie. I'm one of the clinical navigators based here at the Royal Derbyshire Hospital. So we work in the area that the patients come into when they take them off the ambulance. And what we don't do is ask the crews what they've brought the patient to emergency department for. What we do is, if we notice that there might have been a more appropriate place of care for that patient, what we'll do is we'll follow the journey through the hospital of the patient. So we'll often either shadow or see what the doctor says and what the consultant says and what their diagnosis is. Then, when we've got the full picture, if the patient could have been treated or if there was more appropriate place for treatment for that patient, then we will speak to the crew next time we see them, or we can send them an email and just let them know.
Hi, I'm Tim Slater, General Manager and also a paramedic, and I'm responsible for Derbyshire division of EMAS. Clinical Navigators are a pilot initiative put in place for winter predominantly to help patients and also our crews access alternative pathways. Alternative pathways are a range of options available for patients who might have minor injuries, minor illness, or simply need treatment in the home or in the community that prevent them from attending an emergency department. It's been well publicised over the winter and the last couple of years that emergency departments are really struggling to cope with the demands, and likewise the ambulance service is also struggling to cope with the demand and the volume of patients calling 999 when actually they could benefit from more alternative options. So the navigators are there to support crews in the first instance, to signpost them and identify alternative pathways, but also to do research on what is actually out there and available and some of the gaps, and that will then lead to discussions with commissioners and alternative providers to ensure that those pathways are developed further where possible. They're having a really positive impact, proportionally reducing the number of people attending the emergency department, and we're in the very early stages. We're only in the second month of the 6-month pilot, so I'm really optimistic that as time goes on, the team at Royal Derby and Chesterfield Royal will really start to make a difference. As an additional element to that, we've also put 2 clinical navigators into a multidisciplinary team in the Clay Cross area, so they're working very closely in primary and community care to ensure that some of the learning and findings from the emergency department navigators and what pathways and gaps we're identifying can start to connect with what's out there in primary and community care.